Hello and welcome to an instructional video on how to deal with a soccer player with a sprained ankle. A sprained ankle is a direct injury which is caused by an external force, which is the other player causing a tackle to cause the sprain of the ankle. The nature of the injury is a soft tissue injury, which is any injury that is caused to a muscle, a tendon or a ligament which is not bone or teeth. The signs and symptoms of this injury include pain, swelling, tenderness or instability of the ankle. A sprain specifically is a tear of the ligament fibers, which is just around the ankle, and it is important to make sure that the athlete doesn't have a fracture or a stress fracture or any other kind of damage. We're going to use the toe taps technique, which is talk, observe, touch, active movement, passive movement, and skills test. And that's what we're going to use now. So, talking. You can still talk?
Yeah.
Okay, that's good. Observe. So, I can't really see, but because of the angle, but we're going to take the shoe off very carefully. But does it hurt just around there? Yeah? Okay, so it's definitely a sprained ankle. And what we can observe is that she's not trying to move the ankle. Can you move it at all?
Yeah, just has it.
Okay, so we have some movement in the ankle, which is a good sign. And now I'm just going to use passive movement.
Yeah.
Just move the ankle back. Okay, so that hurts there. Okay, and the last one is a skills test, but which we cannot do because she cannot. It's the movement in her ankle is not enough to warrant for this. After she has been taken off the field, which is through assistance, we're going to use the rice technique. So very carefully, we're going to have to either cut the shoe off or just take the shoe off very lightly. Should we do this carefully?
Ow.
Okay. Taking the shoe off. Okay. So the ricer technique is obviously arm rest, meaning the athlete doesn't put any pressure on the ankle. I in ricer is ice. We have an ice pack here with paper towel around it, so it doesn't apply directly. But we're going to use ice and we're going to put it on there for 20 minutes to reduce the swelling and any inflammation that has been caused around the ankle. We're just going to hold it there for 20 minutes. The C is compression. So we use compression to compress the blood vessels around the joint. So we can reduce the amount of blood flowing to the ankle, so it can heal. We're just going to compress the ankle here. Doing this, you want to ensure that the ankle well kept and is not moved at all. Minimal movement, so we do not cause any further pain. Okay, so we've now compressed the ankle. We've taped it up to ensure that the vessels are compressed tightly, and so blood flow stops, so we don't have a rush of blood again. The E is elevation. So what we're going to do is we're going to either get an object or just a person, just to elevate it. And we do this so the blood is so the ankle is above the heart, so the blood flows down from the ankle into the heart, and to stop the blood flow flowing through the ankle. And R finally is referral. Due to her not being able to play further in the game, we would instruct her to go to a physio or a GP so she can get x-rays and to provide any further information on what has caused due to the injury. What we need to do now is we need to start the process of rehabilitation. This includes progressive mobilization, graduated exercises training, and the use of heat and cold. So what we're going to do first is use progressive mobilization, which will help in increasing flexibility and reducing scar tissue, as well as reducing the amount of tension in the ankle joint. So what we're going to do first is we're going to do some light calf stretches, and this involves stretching the calf muscle as well as moving the ankle joint to try and increase movement. Okay, that seems to be okay. So we're going to do a rotation of the ankle. Okay, that seems to work okay, meaning the riser technique has worked, and all the inflammation and swelling has been reduced. Okay, the second part of the process is called graduated exercises. So this component has three parts. So we have stretching, we have conditioning, and we have total body fitness. So first we're going to do stretching. Stretching has three types of stretching: P&F, static, and dynamic. Okay. So first we're going to do some static stretches. So just a normal static stretch would be to sit up. Keep your calf. Yep. Okay. This stretches the calf muscle, and again we are looking at the joint in the ankle to try and release the tension. The second stretch is a P&F stretch. So this is assisted stretching. Okay, so what we're going to do here is just stretch. I'm just going to push back. I'm just going to push this. Okay. This is trying to release all the tension in this ankle and to really stretch it out. The final part of stretching is called a dynamic stretch. So it's when the ankle is constantly moving. You need to stand up and just ground and just try and touch the ground every 5 seconds. And this is ensuring the ankle has movement and is starting to get back into the normal movement. The next part of graduated exercises is called conditioning, and this is with eccentric and concentric. So we're trying as much as possible to get the muscles in the ankle to move normally again, and to get it back to training. So what we're going to do is just some light walking. So just go up and back and just walk, and it stretches like the back of the calf. And to just get normal movement back again. The last part of graduated exercise is called total body fitness. This is when even if you can't exercise one part of the body, it's still important to measure the rest of your body to make sure that reversibility doesn't occur and you don't lose fitness altogether. Okay, so what we're going to do, just going to do some sit-ups, some normal sit-ups. This is just one exercise. Many exercises can be done to improve total body fitness, but we're just trying to isolate other areas that don't involve the ankle joint. The third part of a successful rehabilitation process is training. Training is obviously not full training, but it's going to be moderated or modified to suit the athlete's needs, so she can train without too much aggravation to the ankle, and so we can get the athlete back to training to hopefully get the ankle back to full strength. So she's just gonna normal training. It's just basic skills with the ball. Okay. The final part of the process is the use of heat and cold. Heat, first of all, is used to increase circulation in the major parts of the body, and in this case to the ankle to increase mobilization, to increase elasticity, to reduce the stiffness, to enhance the inflammatory response. It's for relaxation also of pain, and it is used to reduce the pain, but also to increase mobility during training. This can be done through sprays, gels, heat packs, pretty much whatever you can do to training. Okay, in relation to heat, there is also cold treatments. It's also called cryotherapy, which is just another name for cold treatment. You can use ice packs, ice baths, sprays like freeze gels. It helps to, after training, it reduces the swelling, helps for discomfort, to reduce pain and swelling. Now we're going to look at the return to play considerations. If an athlete returns to training and competition too soon after injury, they're at risk of re-injury, which is called a secondary injury. Even when treated, they still need procedures to reduce the risk. This includes the indicators of readiness to return to play. These include balance, example meaning they need to be able to support their own body weight. Psychological, which is an example of confidence. Mobility, which is just the full range of movement in the ankle. Strength, which is an example of the tissue is strong and able to support exercise. Elasticity, which is new tissue has been stretched and is now flexible, which means a full range of movement. And finally, has to be pain-free. The next part of returning to play is monitoring progress, which includes a pre- and post-test. To ensure the injured area has returned to its normal functioning, conducting sport-specific tests will provide both coaches and athletes with information on the athlete's fitness and skill ability. Using a test specific to the sport can give an indication of how their fitness and skill level is progressing after the injury. This test will also place the injured area under competition pressures to see how the body responds. This is just a basic agility test to see whether the ankle is good or not for sport. In psychological readiness, an injury can impact on an athlete's psychological well-being. Athletes may feel that they may lose fitness or their spot in a team if they do not participate in training sessions. This may lead to depressive episodes, which in turn can affect their approach to rehab. Depending on the type of injury, the trauma from sustaining the injury may affect an athlete's ability to participate. When rehabilitating the physical injury, it is therefore important to rehabilitate an athlete's mental capability and make sure they are psychologically ready to restart training and competition. In returning to play after an injury, an athlete's routine needs to include warm-up stretches and drills that are specific to the injured area. Ensuring muscles are warm, stretched, and ready for physical activity is important in preventing further damage. In policies and procedures, sports clubs have a responsibility to ensure that policies and procedures are in place for players returning from an injury. Clubs have a duty of care to ensure athletes are fit to return to training and competition when they are injury-free, not before their injury is healed after clearance from doctors or a physio. As athletes get injured, they are faced with many dilemmas about returning to their sport. Elite athletes in particular feel pressure from their coaches, teammates, sponsors, and society to be back on the field as soon as possible. Athletes may choose to use painkillers that numb pain, like cortisone injections, but this numbness sets the athletes up for further damage.
And I don't need no care, 'cause you had a bad day, you're taking one down, you say this out You weren't gonna smile.